RRBSK MIBRAR. Regenerative reconstruction of the intervertebral discs and spinal canal. The regenerative reconstruction of the intervertebral discs and spinal canal according to MIBRAR can be used for degenerative or traumatic herniated discs in all spinal segments of the cervical spine, thoracic spine, and lumbar spine. A healthy intervertebral disc, which acts like a shock absorber between the vertebral bodies, has a hard outer rim consisting of collagen fibers, the annulus fibrosus, and a soft, gel-like core, the nucleus pulposus. The degeneratively changed, or acutely traumatized intervertebral disc is deformed by the vertical pressure between two vertebral bodies. The resulting pressure in the nucleus pulposus pushes the collagen fiber layers of the annulus fibrosus outwards in any direction and injures them, causing disc protrusion and inflammation. Depending on the direction of the protrusion, this can lead to compression of the spinal cord or nerve root. The resulting inflammation leads to adhesions of the membrane surrounding the spinal cord, dura mater, and the nerve root with the prolapsed tissue. Depending on the affected spinal segment and the severity of the compression, the adhesion and inflammation process, patients may experience loss of strength, numbness or pain in the musculoskeletal system, as well as dysfunction in the internal organs. If the conservative methods are not, or no longer indicated, the current state of medicine is to remove the prolapsed tissue, using the classic open or endoscopic surgical methods, to achieve decompression of the spinal cord and nerve root. In this process, the annulus fibrosus, which provides the stability of the intervertebral disc, is severely damaged. However, this leads to even greater instability of the disc, which can result in a recurrence due to a new herniated disc, or renewed spinal stenosis due to scarring as a result of the surgery. This results in even more severe pathology, and may eventually lead to disc prosthesis or vertebral fusion. As a safe alternative to the classical methods, the regenerative reconstruction of the intervertebral discs and spinal canal according to MIBRAR is possible. In complete contrast to the classical approach, no further injuries are inflicted on the already pre-injured intervertebral disc. The aim is to reconstruct the intervertebral disc through a natural, morphological, and regenerative process, and to completely restore its function. The micro-invasive procedure RRBSK according to MIBRAR is performed without an incision, only with a puncture, micro-invasively without general anesthesia. Under image intensifier control or cyber-Navi hand, a spinal probe less than 1 mm thin is inserted into the affected disc. The diseased disc is microperforated with the spinal probe, and at the same time, an autologous regenerative concentrate, ARC, is reimplanted, using tunneling technique, when the probe retracts. This stimulates a regeneration process by stem cells and growth factors from the autotransplanting ARC. After intervention on the intervertebral disc, the probe is retracted a little bit, without pulling it completely out of the body, and inserted directly into the peridural space of the neuroforamina. A second spinal probe is also inserted through an interlaminar window into the epidural space of the spinal canal. Both probes must be inserted very precisely from different sides. Depending on the shape and location of the compression of the spinal cord, the nerve root, the nerve fibers, as well as adhesions of the dura mater, with the prolapsed tissue and the inflammatory process, fine-tuning is required. Movements of the spinal probe and reimplantation of the ARC under pressure loosen the adhesions between the prolapsed tissue and the dura mater. The epidural space is widened and flushed with ARC, freeing the spinal cord, nerve root, and nerve fibers. Thus, in addition to the mechanical effect, a regeneration process of the spinal cord, nerve root and nerve fibers is created by anti-inflammatory and regenerative properties of the ARC. The regenerative, reconstructive and anti-inflammatory effect of the ARC, including its own collagen, triggers a regenerative reconstruction of the intervertebral disc. The collagen fibers of the annulus fibrosus are reconstructed, the inflammatory process recedes, and a retrograde process of the pathology occurs. As the pathological process subsides, the disc protrusion retracts, the disc reconstructs in height, volume, shape as well as functionality, and decompression of the spinal cord and nerve root occurs simultaneously. By simultaneously intervening on the primary herniated disc and the secondarily injured spinal cord, nerve root and nerve fibers in the spinal canal, we achieve a multilateral, regenerative, and reconstructive effect on the intervertebral disc, spinal canal, and neuroforamina, and thus a maximum therapeutic effect. Advantages of regenerative regeneration of the intervertebral discs and spinal canal. No anesthesia. No incisions. Quick recovery. No hospitalization. No postoperative rehabilitation. No postoperative complications. No restrictions in daily life or at work. No side effects or allergic reactions. Can be performed simultaneously on several spinal segments. No age limit as the regenerative process takes place at any age. No contraindications in the presence of serious diseases or possible use of medication. Leads to natural regeneration and reconstruction of the body. Alternative to open or other minimally invasive surgery and prostheses or other artificial implants.